Hi, my name is Dr. Jerry Law, and I am the Executive Director here at the Meadows. We are treating individuals who often come from a world of chaos, and we want them to have an environment where they can feel everything I need is right here. We want them to feel that stability. We want them to feel like, this is a place where I can just be.
When you have a unifying model that brings all of these parts of treatment together, then treatment becomes very powerful. When your yoga instructor and your primary therapist and your psychiatrist and your nurse are all speaking the same language and are all helping to drive that treatment plan forward, that becomes powerful. Then you've got real momentum in your recovery. And I think that's one of the things that sets us apart. You can go to other websites and see that they offer similar things, but are those things that they offer rooted and grounded in a theory, in a model that has a tradition and a legacy and a history and outcomes research to back what they're doing? I think that's really part of what we can offer.
There is sometimes a misconception that a substance abuse disorder or a process addiction is different than having depression, anxiety, perfectionist issues. Really, they're one and the same. There's an underlying issue, and that's what we look at addressing at the Meadows. What brought you in, and why are we doing the things that we're doing? Most often, that's trauma. Our childhood trauma and the things that happen to us throughout our lives that shape who we are and the things that we do. We're going to be giving you tools to help with that, and we're going to be addressing all of it. Otherwise, we're just putting on a Band-Aid. The therapists are passionate, and they're excited, and they care so deeply. All the things that they're asking patients to do, they do it themselves. They are masters of the information. They know some of the challenges that are going to arise. It's really a beautiful thing.
So we'll often have people come in and say, well, I don't have trauma in my life. And as we begin to peel back the layers of the onion, quite often it's amazing to see the light bulb come on. Those aha moments when a patient is able to connect whatever's going on in their life that brought them into treatment to life events, often going back to pre-verbal days. It is amazing to be able to watch the transformation that takes place from the time a patient arrives until the time they leave.